Hello, thank you all so much for joining me today. Unfortunately, I'm not able to be there with you in person live, but I have pre-recorded this. Unfortunate change in flight has required me to do a pre-recording, but Mead is here with you live. Happy to answer any questions you might have after the presentation, and she is phenomenal. So you're in amazing and excellent hands as we move forward. But quick introduction about me before I really dive into a little bit about Erika's Lighthouse and this kind of inside Erika's Lighthouse presentation. I am Brandon Combs. I'm the executive director. We have been doing some amazing work over the past 17, almost 18 years now. And then I've only been with us for about 2 of those years, and excited to continue moving us forward in such a positive path. Particularly after this year with the pandemic, and coming back out into what we hope is normalcy within the school year next year, really being sure that students within school communities are feeling supported and heard, and that they know where to get help. And that's really what Erika's Lighthouse is all about. So let's get into it, and I can tell you a little bit more about what we do. So Erika's Lighthouse was founded in 2004 after the loss of a 14-year-old who died of her depression. It was the second suicide in the community in the school year of a young person, and that really motivated the family as well as the entire community to come together and find solutions on how we can really address teen depression and suicide. We are a mission-driven organization dedicated to educating and raising awareness about adolescent depression, encouraging good mental health, breaking down stigma surrounding mental health issues, and really helping teens kind of figure out that help-seeking piece. Who is their trusted adult? Who is a peer they can talk to? And how do they do that? We do this through free programs always. So all of our programming, from our classroom education to our teen empowerment club, the school policy and development, staff development piece, and parent resources, are all free, and they're all delivered through school communities. And our classroom education is evidence informed, meaning research has been done on our own programming to show that it is effective in as few as one lessons. And then we have continued to maintain that as we've developed new curriculum and new resources as we move forward. As of today, I'm excited to say that we have reached over 1 million teens since 2004 through our programming. This past school year alone, we reached 218,000 teens in 558 schools across 43 states, as well as 6 countries. We continue to grow, and we'll talk a little bit more about our growth later, but we're so excited about where we're at, how we can help teens around the country and around the world to know that they're not alone. Everyone deserves good mental health, and how we can help them. Our core messages, you've already heard a couple, but depression is a mood disorder. It is common, it can be serious, and it is treatable. Everyone deserves good mental health, and that you are not alone. There is hope. And these are themes that resonate throughout all of our programs as we work within school communities. Our ultimate goal and belief is a strong belief in supporting inclusive school cultures. And inclusive school cultures focus on universal prevention, education, and awareness. They are proactive about mental health messaging and help seeking. They are empowering teens through peer-led campaigns and stigma reduction. They're going to focus on school policies, professional development, staff culture, and self-care. They're going to engage families in student learning and mental health awareness. And they're going to promote interconnected, multidisciplinary collaboration and implementation within schools. And our role and our goal is to help schools get to that point where they believe that and recognize that they have an inclusive school culture that can really help any teen that might be in their building struggling. And we do this through 4 main pillars. Classroom education is really our largest and main one. We'll talk about that a little bit here in a minute. We also have school policy and staff development, so effective interventions, staff trainings, and more. Family engagement through family night workshops in partnership with the National PTA, our own parent handbook designed by us and consistently updated, and our teen empowerment activities, which include teen empowerment clubs, affiliate clubs, awareness into action activities, so that teens can feel empowered and really take the lead in creating those inclusive mental health environments on their own. Our classroom education, which I mentioned, is really kind of our largest segment, is really done through 3 main programs. These are together or standalone, and they range all the way from grades 4 all the way up through 12. The 3 programs, level 1, 2, and 3, Level 1 for upper elementary grades 4 to 6 really is this good mental health. We all have mental health message, the difference between everyday feelings versus overwhelming feelings. Level 2 is depression awareness, grades 5 through 9, really touching the surface of what is depression, how do you get help for it, what to look for, also good mental health. And then level 3 is our depression education and suicide awareness, which is a deeper dive into depression and a further conversation surrounding suicide prevention work. And there's a lot more peer support discussion in that program as well. But we work with schools either in elementary all the way through a high school, again, as a standalone within potentially a health education classroom, to this broader goal of this inclusive school culture that we've talked about. So the ultimate goal for us is that schools utilize our programming so they find what's effective for them, and the programming that we create is flexible and adaptable based on what that school environment is looking for and needs for their student population. And I think that's really key. So some of our districts are using us in grades 4 through 12 every year for every student in that school building. And some of them are, say, maybe implemented in a 9th grade health education classroom within a high school building. So again, every school is unique and different and knows that they need their own programming from a classroom education standpoint, and we're here to support them in that effort. A few of our recent successes we're really excited about. I know I've mentioned the level 1 upper elementary program. We all have mental health. This is a brand new program. It is launching, it's technically launched now, but for the school year will be August 2021. We have had a number of schools pilot the program last year. It was also our remote learning program last year during COVID. So we're really excited to see this launch. That was with support from Blue Cross of California. We also have the remote learning program, which I mentioned was for grades 6 through 12, and was really a softer touch for schools that were in a remote learning environment, but we're obviously concerned about student mental health, to still have programming that's not going to potentially be triggering for students within that classroom. Also, we have some school partners that we're excited about. So this year, we are the official provider of staff training for depression education and suicide prevention for Chicago Public Schools, meaning over 39,000 staff within the Chicago Public School system will receive the Erika's Lighthouse staff training program. And then I had mentioned the level 1 program, the Way Off Mental Health, that was piloted within the Los Angeles Unified School District last year. So we love our partnership with LAUSD, and we're excited to continue seeing that grow. We also have some exciting partnerships. We are the official partner for mental health resources for Kiwanis Key Clubs, which has over 200,000 members worldwide, as well as their Builders Club, which are their middle school programs. Going to a conference, actually, the conference I was coming from when you'll be watching this was part of the Key Clubs, and presenting to students worldwide about how they can implement mental health awareness resources within their own school building, leveraging Erika's Lighthouse. And also just got back from a Florida Department of Education conference focused their summer academy for health and physical education teachers and supervisors on how our curriculum can be implemented effectively within the state of Florida at various school districts, some of which are already strong partners of ours. So we're excited to see that grow and continue. So where are we now? This is a map of current Erika's Lighthouse programming within schools. This was actually a year and a half ago, but we're very similar to where we are now, considering COVID. We will get this mapped up updated shortly, but you can see we are nationwide. We have expanded to a few more states from where we were last year, but I will get this updated for the next presentation. But it's exciting to see our growth and to see what we've been able to do over the years. And a great example of that is this chart. So this is actual and projected growth. The actual data is from 2004 to 2021. And then the projection is based on our strategic plan. I'd be more than happy to share more about that with you. I'd also be happy to speak with you about additional investments in our organization, either monetarily, time, in kind, whatever that could be that can really help us continue to grow. But by 2025, we want to be impacting over 1 million students annually. So the plan right now, we just reached 1 million students this year since 2004, and we know that we can do that every year by 2025-26 school year. And that would mean us being in over 5,000 schools, having 250 teen clubs in 50 states, and on an annual basis, be distributing over 25,000 parent handbooks to families that need those resources, and have a better understanding of what their child is going through, if they are struggling with anxiety, depression, and other mental health challenges. So if you want to get a deeper insight into our programming, see our curriculum, watch our absolutely amazing videos. I cannot stress enough how amazing they actually are, and I cannot take credit for that, so I can say it. Go to erikaslighthouse.org. You can click on the resource portal button, and you'll be sent immediately to just a quick free registration system, and you'll be given instant access to all of our materials. Literally everything is in that portal for free. And then in working with our school communities, one of the other pieces is all of the support we're currently offering schools is also free. So the consultations, the conversations, how to best implement that program is included within our model of a free program. So with that, I'm going to turn you over to me to answer any specific questions you might have. But thank you so much. We deeply value your partnership, your investment in us as an organization, and we look forward to continuing that. So Mead, I will let you take it from here, and thanks so much.